Okay, so let me introduce myself. I'm Dr. Sumbal Ijaz, Senior Lead Mentor at Med Institutes. Welcome, everyone. I hope everyone is doing fine.
Yes.
Yes, how are you, Dr. Sumbal?
I'm good. How are you?
I'm good, thank you.
And how's everything going so far?
It's just starting right now.
Okay, I'm happy to know that.
Thank you.
And how you are getting along with your studies?
Dr. Sumbal not started anything. Um, just waiting to join this group.
Okay, don't worry about that. We are here to help you and support you. So in today's session, definitely I will try my best to address all of your queries regarding orientation of MRCOG exam, like what are the benefits of this exam, how to book this exam, how to study for it. So let's hope for the good. So due to high volume of inquiries we are getting from the students who are interested in the upcoming MRCOG 1 exam, so we at Med Institutes are pleased to announce the start of our second batch for the January 2025 MRCOG Part 1 exam. So let's begin. Why MRCOG? And this is a very common question, which I think which comes in everyone's mind before writing or booking for any exam. So let me give you a brief. What are the benefits and what is this exam for? Basically, it is the membership exam of Royal College of Obs and Gynae, which is located in London. So once you clear, this exam has 3 parts, which is part 1, 2, and 3. And once you clear all the parts, you will get registered, you will get a golden membership from the Royal College of Obs and Gynae London. And after that, you can you get the global recognition and you can practice as a consultant in any country globally. And yes, one of the major benefit for after passing the MRCG exam, you will get the general medical license, which you will get from the GMC. And once you hold that license to work in UK, you can also apply for the jobs or work in the UK. Definitely, as I told you, you will earn high credibility in most of the countries because this exam is recognized globally. You can work at the senior level in all countries, etc. So these are some of the benefits for passing MRCG exams. So today's content or the objectives of today's session, I will mainly address the exam structure, exam calendar, exam fees, eligibility, booking process, study material, and anything else you want to know. So again, MRCG exam has 3 parts. Part 1, which is theory-based exam, MRCOG Part 2, which is again a theory exam. And then the last step is MRCOG 3 exam, which is OSCE based exam. So let me give you a brief. MRCOG 1 exam is all about your foundation and basic knowledge like anatomy, biochemistry, all of the foundation subjects you have already studied in MBBS, and a bit from the clinical. Then MRCG 2 exam is all about the obs and gynae clinical management. And honestly, this is one of the challenging exam as compared to part 1 or part 3. But once you will pass this exam, it is very easier for you to clear MRCG 3 exam within a period of 3 to 4 months. MRCG Part 1 is computer-based exam that includes single best answer questions. So this is a basic exam structure. There are many books which are not yet updated. You may find some different sort of questions like extended questions or maybe true false statements. But one thing you need to keep in your mind that this exam only includes single best answer question. And yes, another thing is that Make yourself clear about the difference between MCQ question and the single best answer questions. Because in single best answer questions, maybe you find all the options correct, but you have to choose the best answer. So this is the tricky part. Then in the exam, you will get two papers. One is the paper A and the other is the paper B. The paper one have 100 questions, 100 SPAs, and same goes with the paper B. Paper one have, you will get the time 2 hours and 30 minutes each for paper one and paper B, and you will get 1 hour break in between these two papers. Am I clear so far? Okay. And one thing, when I was writing my exam, I get to know that while writing my exam that I'm also able to take unscheduled breaks. That means if after 30 minutes I found myself hypoglycemic or I need some break or I felt exhausted, I can take unscheduled break. But definitely that time would be deducted from your exam time. For example, if you are having 2 hours and 30 minutes, and out of these 2 hours and 30 minutes, you will have your 10 minutes unscheduled break that would be deducted from here. However, this 1 hour break is also optional. If you want to go and write both exams in one go, you can also opt that. However, I recommend to take at least 30 minutes break between paper one and paper B so that you will relax during this time. Okay, now how to book the exam. It's pretty straightforward. However, there are many steps, but all the steps are very easy. And yes, if you have proper guidance, a mentor with you, you can easily go through from these steps for exam booking. So the first and the foremost step is your eligibility. What is your eligibility and what does it mean and why the RCOG has set this step? Basically, they want to filter out who are the doctors who are eligible to get the membership from the Royal College of Obs and Gynae in future. So they have to filter out, they have to check your credibility, your medical, especially they ask you for your primary medical qualification. That means, are you a doctor or not? They have to verify that. And the second thing is your ID. Maybe you can use your ID copy or you can use your passport. Along with this, there is a form which is eligibility form available on the RCG website, and we also have that form. You need to fill that form thoroughly, then attach your primary medical qualification, or you can use your medical license, and along with your ID or the passport, and you have to email them to the RCOG. For the time for this step would take 4 to 6 weeks. One thing, please be careful while filling your eligibility form. Don't do any mistakes because already this step would take 4 to 6 weeks. And if you made some error while filling your form, that would definitely delay your eligibility approval time. So be careful with that. And yes, don't attach unnecessary documents. I have seen many students who attach all of their metric certificate, their intermediate certificates, and their specialty certificates. Don't do that. Attach only limited documents, only that document they are asking for. And the most important thing, there is no fee for the eligibility. So it's a free step. You can apply for the eligibility anytime, but before the ending date. Okay, so the subjects you need to cover in order to study for this exam is all your foundation year subjects, including anatomy, biochemistry, physiology, endocrinology, micro, pharma, biophysics, pathology, genetics, immunology, embryology, clinical management, and data interpretation and statistics. So these are all of your basic subjects and the foundation subjects. The good news here is that you only need to focus on the topics which are relevant to the obs and gynae clinical practice. For example, if you are studying pharmacology, there is no need to go throughout whole pharmacology. Only focus on the drugs which are used in the obs and gynae practice. like contraception, anticoagulants, like NSAIDs, which are safe to use or which are contraindicated. What are the antibiotics which are safe during pregnancy or in the postpartum period? So this is how you can tackle pharmacology, and same goes with all of the subjects. Am I clear? If any of you have any question, you may ask me anytime, or you may open up your mic and ask me question directly. I highly encourage those students who came forward and asked the questions. Okay, so what are the recommended books? How to start for this exam preparation from the scratch? So the recommended books by the RCOG are Oxford Revision Notes and Essential Revision Guide. These are the theory books, and yes, since this exam has SPA format, so you have to solve questions, and the more you practice those questions, those SPAs, the more you will polish your knowledge. You made your reflexes. So for the SPAs, it's the recommended book is Angiosizer 550 SPAs by Catherine, SPAs by Ankush, and Get Through SPAs. So these are some of the recommended books. You can, these books are available in the PDF form, so you can easily get that and start your preparation. And what we recommend, what books we recommend are, again, Oxford Revision Notes for the theory, Essential Revision Guide. You can study one book, or you may use a second book as a reference. Like, for example, if one topic is not sufficient in Oxford, then you can go and go through from the Essential Revision Guide and cover that topic from there. Then 550 SPAs we highly recommend, because I personally like Catherine because it has a combination of both SPAs and a true false statement questions. However, again, the format of the question of the exam is not true false statement, but why I like this book, because when you solve those true false statement question, you will cover all the topic. It would help you to retain the theory, to make your concepts clear, and meanwhile it would develop your reflexes to solve the SPAs as well. Then exam type questions, yes, you have to cover previous 5 years recalls. Before, if you don't do that, please don't appear in the exam, because it is very, very important and it's crucial to pass the exam. So what we recommend at least 5-year exam type question, and try to cover them, revise them at least 2 to 3 times before the exam. And yes, pass MRCOG, it is a highly recommended book. Okay, coming back to exam booking process, let me give you a brief. How will you go in steps? First of all, you have to go on the RCOG website, sign up there. It's a very simple process. We used to sign up in many apps and many accounts. So it is a very simple process. All you need to go and sign up there, make your own account, and please make sure don't make any spelling mistake. Make sure your credentials are similar to your primary medical qualification. Okay, once you register yourself, you sign up, you will get an email in which they will send you your school ID, and that is the ID which would remain you till your completion of the MRCOG exam. So it's your permanent ID. Then eligibility, I have already explained you how you will apply for the eligibility, complete your form, attach documents and email them to the RCOG. It's a free step, there is no fee, and the process would take 4 to 6 weeks. And once you are done with eligibility, you will get an email of confirmation from the RCOG that you are eligible to write the MRCOG exams in future. It's a once in a lifetime step. Once you are approved by the RCOG, there is no need to go and apply for the eligibility again and again. This is just a one-time step. The second step would be expression of interest. So what is that? Why the RCOG has made this step? Because they want to filter out who are the candidates who are appearing in the January attempt and who are the candidates who are appearing in the July attempt. So that's why they have made this option. So what you need to do after getting your eligibility, or it can be done before your approval of eligibility, there is no limitation. But there is only limitation: do all your steps before the ending dates. Okay, so go on the January attempt and fill and submit your expression of interest there. It's a very simple process. Again, all you need to do, log in into your RCOG account, go on the January 2025 exam and submit there your expression of interest. That's a simple step. And once you are done here, you need to wait till the exam opening date, the day when the seats would be announced. And I always recommend my student, don't waste your time. Make your card ready, make your amount ready in your account. And soon after the seats would be announced, try to book as early as possible, because the seats sold out very quickly, even in a few minutes. So book your exam and schedule your exam, your time, your date, and your location according to your feasibility. And this is the step where you are going to pay the fee. Okay, if anyone have any question regarding how to book the exam, you may ask me. Otherwise, I will move on to the next topic, which is how we will start exam preparation. Okay, I think everyone is clear about how to book the exam. However, if any time you find yourself confused, you may contact our team. We are here 24/7 for technical support and for your any support if you need it for the exam. Okay, so how we can start the preparation? We know we have many subjects. We have 12 to 13 subjects in our module. And all of those subjects are the basic and foundation subjects. And we haven't been in touch from those subjects from the last 2 to 3 years, maybe. So what I recommend, that it's not possible for everyone to cover all the anatomy or all the pharmacology or immunology. So the right and the smart way to ace this exam is to focus on the high yield topics first. So you should have a list of topics which are important, which are repeatedly asked in the previous exams, and what are the favorite topics of the RCOG. What's the purpose of focusing on the high yield topic is that it would build your confidence, and it's not possible for anyone, since the medical knowledge is very volatile, that it's not possible to retain or memorize all the anatomy, all the biochemistry or the immunology. So it's a wise thing. It's like, you may say, it's a quality over quantity. Try to focus on the high yield topics, have a good grip on those topics, retain those topics, practice as many as SPS from those topics. It would be far better than covering all the subjects and at the end know nothing. Okay, now you have the list of high yield topics, how to follow them. We have divided all the high yield subjects or the subjects into daily schedule, which is the daily mini schedule. You will assign a task on the daily basis that this particular topic you need to cover in this day. Then you can join the live sessions. We conduct the free live sessions on and off, and we do have the premium live sessions of each subject, in which we clarify concepts of each subject. Okay, Dr. Mena, it depends. Are you doing any job or are you not doing any job? And how many hours do you manage in a day? What are your other responsibilities in your life? And how many years you have, it's been passed that since the day you graduated? So there are a number of parameters. We discuss on them, and then we can recommend a better time period that you need to spend on the daily basis. However, the average time, I think 5 to 6 hours daily. If you are studying for the exam and if you want to clear that in 3 months, so daily would be 5 to 6 hours. Okay, the most important thing if you want to ace the exam in first go is that practice SBs daily. Practicing is the key to pass this exam. I never ever recommend my students to go and memorize theory again and again and read too many theory books. That's not a wise approach because at the end, that would not gonna help you. Only try to read theory or listen to the live lectures just to clear your concepts, recall your previous knowledge, and then after that, you need to practice SPS. And for that, we have daily Telegram SPS group discussion on the daily basis. Once you're done with that, then you can also practice exam-like questions, which are available subject-wise on our website. Then once you are after completing a subject, you will have a subject-wise mock on the website, which is very beneficial to identify your weak areas. Then you will also get evaluated by the mentor for each subject to build a strong foundation from the beginning. So this is how we are going to start our exam preparation. So what you're gonna have as a premium student with us, you will get a website access, you will have a WhatsApp group, Telegram study group, a course schedule, and yes, the mini schedule in which you will assign a daily task on the daily basis. And this is very, very beneficial. It will keep a competitive environment and it will keep you motivated. Resources on the website would be main schedule and the mini schedule, live session, Zoom links, live session recordings. You will get all the books in the PDF form, subject-wise mock, subject-wise recalls, PDFs. PDFs are basically the live sessions, the lecture which would be presented during the live session. You will later on get in the PDF form so that you can quickly revise those notes. Then yes, at the end, you will have a big mock exam. Again, website access, you will get books, live session recordings, subject-wise exam type question, year-wise exam type question, subject-wise mock, PDF of all subjects, revision flashcards, and the big mocks. So these are all the things are included in our premium package. Okay, I have done a session. The previous live session was all about RCG curriculum in which I explained all the knowledge areas and the requirements which are provided by the RCOG. So today, I'm only giving you an example like how you can follow your curriculum and how we are covering the curriculum. So I highlighted here for the subjects or the knowledge requirements from the anatomy. For instance, you are studying anatomy. So these are the areas they have particularly mentioned you need to cover in terms of anatomy. So in knowledge area 4, which is your post-op care, they have mentioned that you should be knowing histopathology of pelvic organs, breast, endocrine organs, including the pituitary and the hypothalamus. Then they have mentioned that maternal, anatomical, endocrine, and physiological adaptations occurring in pregnancy. So it's a combination. The endocrinology and physiology would be covered in endocrinology and physiology. However, focus on the maternal anatomy, they are asking to cover that topic as well. Fetal anatomy, then female perineum and principles underlying the management of perineal repair. Anatomy of female reproductive tract, including an understanding of changes at puberty and at menopause. Then anatomy, development, function, and cell biology of all organs of male and female reproductive tract in context of their relevance to fertility and its disorder. Then surgical anatomy of abdomen and pelvis. Pain pathways, transmission of pain, centrally and pathology of pain in gynecological malignancy. Then the last one is structure of bladder, pelvic floor, and their innervation. mechanism of continence, micturition, and principles of pelvic floor support. So this is all about anatomy. They have mentioned in the MRCOG 1 curriculum, and nowhere in the curriculum they have mentioned you need to cover anatomy of thorax, upper limb, or the lower limb, or the head and neck. Am I making sense so far?
Yes, ma'am.
Okay, so this is a demo because many of you, I already received many questions in the previous batch. Students sometimes confuse themselves. They think that they need to cover anatomy of upper limb, lower limb, thorax, and head and neck as well. However, the purpose why I am highlighting the MRCG1 curriculum, that you should be reassured that we only need to cover anatomy of abdomen, pelvis, and perineum. Okay, if anyone have any question, okay, let me see. Okay, Dr. Fayal, okay, you have the obs and gynae clinical experience, but according to you, you have changed your hospital in last 4 years. That's fine. There is nothing wrong with that. We have that form. It's basically it's a similar process like you are applying for the eligibility for MRCG Part 1 exam. There is another form in which the RCG try to assess your clinical experience. And that would be, you need to submit that form once you clear your MRCG2 exam. But we can share to you so that you can read that form by yourself so that your query would be addressed in a better way. However, that's fine. If you change your hospital, that doesn't matter because they have the columns. If or they already have the columns in which if you change your hospital, you can mention the hospital's name. But yes, you need the signature of your supervisor from every hospital. Dr. Sadia, it depends on you. If you can easily study from the laptops or your iPad screen, that's fine. Otherwise, there is no need to buy hard copies. Neha, there are many benefits if you pass MRCOG exam, because once you complete your membership, you will get a GMC, so you can work in UK. And yes, it would give you a global recognition because MRCOG is globally recognized. If you move to, for example, if you move to Middle East, you will consider it as a consultant. Abida, that topic you will find a bit in genetics, and a bit in biochemistry, and rest would be covered in pathology. Dr. Sadia, apparently the RCOG didn't ask for any gynae experience to write MRCG2 exam. You can simply book that. If you clear MRCG1 exam, you can easily book MRCG2 exam. There is nothing wrong with that. However, the problem falls where if because MRCG2 exam is all about clinical knowledge and clinical practice in obs and gynae. So if you have a good clinical experience, that would definitely help you in understanding the MRCG2 exam. However, it's not impossible. If you are dedicated enough and you can spend 6 to 7 months and you can study 6 to 7 months thoroughly with full dedication, you can pass the exam. Neha, for part 1 and part 2, uh, only your first eligibility form is more than enough. For MRCG3, you need 4 years clinical experience in obs and gynae. Dr. Manira, we can share with you once the session is over. we will share that in the group. Okay, so let's move on to the anatomy. I was trying to give a demo lecture so that you know how to study anatomy for the exam. And yes, I wanted to motivate you so that you can start your exam preparation today. So let's begin the topic, which is a high yield topic from the RCUG curriculum, which is femoral triangle. Okay, so where is the femoral triangle located? And what is femoral triangle? It's a wedge-shaped area formed by a depression between the muscles of the thigh. And as you can see here, it is located on the medial aspect of the proximal thigh, and it is the region of the passage of the main blood vessels between the pelvis and the lower limb, as well as the large nerves supplying the thigh. So what I can do, I have a video because I believe anatomy is all about the visual study. And the more you have the graphics in your mind, it is more easy for you to retain anatomy and the different relations of different structure. So there is a 4-minute video, which is a worth watching video about the 3D model of the femoral triangle. And once you watch that video, I will continue and share the objectives of femoral triangle and what is the high yield information you need to extract from this topic. And at the end, we will practice an SPA.
Given that the femoral triangle is a 3D space containing some important anatomical structures, think of it as a pyramid. The mnemonic SAIL helps us to remember the lateral, medial and superior borders. That's sartorius, adductor longus, and the inguinal ligament. But there's also a floor and a roof to this 3D triangle. Let's get rid of this 2D image and bring in some 3D elements now. Got the femur there, sartorius, adductor longus, the inguinal ligament, and then down the back, pectineus and iliopsoas. So the floor of the femoral triangle is made up by the body of adductor longus, the body of pectineus, and a little bit of iliopsoas as well. Again, the floor of the femoral triangle is made up by adductor longus, pectineus, and iliopsoas. The roof is made up by the fascia lata, which is the border of the main fascial compartment of the thigh. You'll know it from the tensor fascia lata, a muscle which stretches it out on the lateral side. There's a little hole up here in the fascia lata, which is called the saphenous opening. The greater saphenous vein pops through there. And of course, the femoral triangle is open up the top to allow in its contents. And we'll take out the inguinal ligament and bring them in here. So lateral, we have the femoral nerve. Next, we have a fascial compartment called the femoral sheath, which contains the femoral artery, femoral vein, and the femoral canal. The femoral sheath ends by blending in with the adventitia of these vessels around 4 centimeters below the inguinal ligament. The femoral canal ends earlier, up here. It contains one single lymph node. After entering the femoral triangle, the femoral nerve divides into branches which supply the muscles nearby with innervation. That's the quads, sartorius, and pectineus. It spits out anterior cutaneous branches to supply sensory innervation for the medial thigh and knee, and its saphenous branch supplies the medial lower leg. The femoral artery and vein slink down together along the bed of adductor longus and magnus, and once they're past the border of sartorius, they're out of the femoral triangle and into the adductor canal. Efferent lymphatic vessels coming out of the node in the inguinal canal then make up the deep inguinal lymph nodes of the thigh.
Okay, coming back to the topic, the purpose why I have uploaded that video, because I know many of us, we haven't been in touch with the foundation subjects like anatomy. So it's a good idea if you have some good visuals prior to start the topic. So again, the first thing, femoral triangle, where it is located on the medial aspect of the thigh in the proximal area. And it is a wedge-shaped area, as you can see here and in this picture. So this is the exact location of the femoral triangle. So what are the objectives you need to cover in terms of the exam preparation? So you should be knowing, please note down, you should be knowing the relations of the femoral triangle, what is femoral sheath, what is the contents of femoral triangle, what is femoral canal, and what is femoral ring. So these are the objectives, these are the areas you need to study when you are studying femoral triangle. Am I clear?
Yes, ma'am.
Okay, so let's talk about the boundaries of femoral triangle. As you have already seen in the video, they have mentioned a mnemonic SAIL, SAIL. So these are the these are the boundaries which made the femoral triangle. So let's talk about the lateral border. The lateral border is formed by the sartorius muscle. Medial border is formed by the adductor longus muscle. Superior or base is formed by the inguinal ligament. The floor is comprised of four muscles, mainly adductor longus, pectineus, psoas major, and part of iliacus muscle. And the roof is formed by the facial lata, superficial fascia, and yes, the skin. So here you can see the relations, the boundaries of the femoral triangle. Please tell me what border is this and by which muscle it is going to be formed.
This is lateral border formed by sartorius.
Yes, excellent. And which part of the sartorius muscle? Which border of the sartorius muscle form the lateral boundary of femoral triangle?
Medial border of the sartorius.
Yes, because this is a confusing point, because many of the students think since the medial border of femoral triangle is formed by the medial border of the adductor longus, so they think the lateral boundary is formed by the lateral border of sartorius. That's not true. It is reversed, that lateral border of femoral triangle is formed by the medial border of sartorius muscle. So this is, make yourself clear about this. Then we have this inguinal ligament superiorly. So this is a triangular or wedge-shaped area, which is known as femoral triangle, and these are the boundaries. The next SBA, which comes from the contents of femoral triangle. The main contents of femoral triangle are femoral nerve, femoral artery, femoral vein. So what type of questions you will get in the exam? They will ask you simply, the questions in the exam are very straightforward. They directly ask you the order or arrangement of the contents of femoral triangle from lateral to medial. So please notice the keyword. I have highlighted the lateral to medial this words because sometimes they twist the question. Maybe they will ask you, please pick the option in which the contents are arranged into medial to lateral order. So please make sure, because the arrangement would be different. When we go from lateral to medial side, the order of the contents would be femoral nerve, femoral artery, vein, then femoral canal, and lymphatics. So the mnemonic for this is navel. But yes, if they ask you from the medial to lateral side, then you need to follow this this order. In that way, your answer would be the mnemonic van, femoral vein, artery, and nerve. Is everyone clear about this?
Yes.
There's just these two variations of the question in the exam from the contents of femoral triangle. Either, I repeat, either they will ask you to arrange the contents of femoral triangle in lateral to medial order or the medial to lateral order. What students usually do, they rush, they just overlook the question statement completely and answer and mark the answer, and they ignore such statements. However, they twist around the question in such way. It seems like the question is very easy, but they usually do such things. Here you can visualize the contents of a femoral triangle. If you go from lateral to medial side, we have femoral nerve, femoral artery, femoral vein. Then here we have our femoral canal. And here you can see the transparent green area, which covers the upper 3 to 4 centimeter of contents of femoral triangle. This is known as femoral sheath. And please note, femoral sheath do not encloses the femoral nerve. This is another SPA, that which of the following contents are not the part of femoral sheath. So you have to exclude femoral nerve from that. And it is very obvious femoral nerve is not enclosed by femoral sheath. Okay, so what nerve is present? Okay, I have a question here. Is femoral branch of genitofemoral nerve is enclosed in femoral sheath or not?
No.
Okay, I will clear this point. Okay, for now, again, what were our objectives? We for now we have discussed about the boundaries of femoral triangle, then contents of femoral triangle. Now we know that what is femoral sheath, where it is located, and what are contents of femoral sheath. Then we have on the most medial side of femoral sheath, we have femoral canal. This area is femoral canal, and the opening of femoral canal is known as femoral ring. So these are your 5 objectives in femoral triangle. Okay, in the femoral triangle, the contents excluding the femoral nerve are enclosed in a wrapping of fascia called the femoral sheath. The sheath is funnel shaped, best described as a sleeve of fascia extending towards the apex of femoral triangle, where it fuses with the adventitia vessels. It is continuous spirally with transversalis fascia and iliac fascia of the abdomen. Okay, why I have added these theory lines, so that you will know how to extract the high yield points from the theory books. For instance, if you are studying this topic from the Oxford, there is no need to memorize each and every line written here or written on the books. All you need to extract your important and high yield information, like what type of questions comes in the exam and what type of information, what are the exceptional information you need to remember. And I believe it is not a wise thing if you start memorizing all these lines. So what I did, I just picked out the high yield information. I know the contents are important, so I just focused on the contents. And I tried to make my mind what type of questions would come in the exam, what would be the exceptions, like I need to keep in mind, are they asking about lateral to medial or they asking about medial to lateral order. Similarly, now I know what type of question would come from femoral sheath. In terms of its contents, they might ask me a question: is femoral nerve is a part of femoral sheath or not? So this is how you will extract your high yield information from the theory books, whatever books you are following. But you need to focus on the important points and which are relevant for your exam. Again, let me show you here. As you can see here, femoral branch of genitofemoral nerve is enclosed in the femoral sheath. So the answer would be yes. Only the femoral nerve is not enclosed. For example, if you get an SPA, your question is, which of the following structure is not the part of femoral sheath? Or in a reverse order, which of the following structure, or you may say all of the following structures are enclosed in the femoral sheath except. Your options would be femoral artery, femoral vein, lymph nodes, femoral branch of genitofemoral nerve, and femoral nerve. So what answer would you pick?
Femoral nerve.
Yes. So please make your mind. Femoral branch of genitofemoral nerve is enclosed in the femoral sheath. As you can see here, it is enclosed in the femoral sheath. Okay, further, if we look into contents of femoral sheath from the superior view, we can see that it is further divided into three compartments. This is the lateral most compartment, in which you can see here we have femoral artery, as well as we have a femoral branch of genitofemoral nerve. Then we have intermediate compartment, which have femoral vein. Then we have the medial most compartment, which have femoral canal containing lymph nodes of Ploquet or Rosenmiller. So this is all about femoral sheath. Again, I will show you here. The medial part of the femoral sheath is known as femoral canal, which contains the lymph nodes, and the superior border or the entry point of femoral canal is known as femoral ring. Again, here is your theory. You might find this theory in various theory books like Oxford or Essential Revision Guide or any book you are following. But yes, what you need to remember, you need to remember the high yield points, what are the contents, what are the arrangements of contents, and what are the exceptional points again. So let me read this for you. The femoral canal is the smallest anatomical compartment located in most medial part of femoral sheath. It is 1.3 centimeter long. The opening to femoral canal located at superior border known as the femoral ring. The femoral ring is closed by connective tissue layer by the femoral septum. The septum is pierced by lymphatic vessel exiting the canal. Ploquet node is the lymph node situated in the femoral canal. So again, here you can visualize, this is the inguinal ligament. Anyone please tell me what is the extent of inguinal ligament? Like from where it is originating and from to where it is inserting.
From
Any
superior iliac spine to pubic tubercle, anterior
Yes.
superior iliac spine to pubic tubercle.
Yes, excellent. That's a wonderful answer. So here is your inguinal ligament. Here you can see the contents of your femoral triangle, femoral artery, vein, and nerve. And here you can see here the femoral sheath. Okay, and here in red color you can see it's the lacunar ligament, which makes the most medial border. Again, this is a better picture. Here you can see how the femoral sheath excluding femoral nerve. Femoral nerve is outside the femoral sheath, and within the femoral sheath we have three compartments. The lateral contains the femoral artery, intermediate contains the femoral vein. Here the femoral branch of genitofemoral nerve is not showing, however, it is also the part of lateral compartment. Then we have femoral canal, and the top or at the superior border or the entering point of femoral canal is femoral ring. And the medial border of the femoral canal, you may say, is formed by the lacunar ligament. So this is all about femoral triangle. Basically, Sadia, the femoral canal has a group of lymph nodes which are known as lymph nodes of Ploquet. So basically, it's not one lymph node, it's a chain of lymph nodes or a group of lymph nodes, you may say. Okay, so here's your question, and you have 45 seconds to answer this question. The femoral triangle is bounded medially by which of the following structure?
Adductor longus.
Okay, write your answers in the chat box. Okay, I think we have got enough answers. Okay, so yes, the answer is C, adductor longus. Well done, everyone. I wanted to make sure everyone is listening to me or not, and are you able to solve the SPA with confidence or not? So this is how it is important to understand the basic and have basic concepts regarding each and every important topic so that you can solve the SPA with a good confidence. Okay, so I wanted to share some tips and tricks to solve SPAs. Whenever you are solving SPAs and whenever you get a question, try to understand the question first. Sometimes what they do, they give you a distractor. For example, they will give you a long history of a patient who presented in the emergency room with bleeding or anything, and at the end they will ask you a question regarding blood supply to the ovary maybe. So the last line of the question is important. Usually there are many questions in which they give a different distraction statement so that you will confuse yourself, and they try to waste your time as well by doing that. However, the last line of the question is very important because that's the thing they're expecting from you to answer correctly. So don't rush in answering the question. Another thing, sometimes it happens, this trick many times worked for me. Whenever I'm not sure about the answer, what I do, I use my background knowledge and try to exclude the most irrelevant options. And at the end, you might left with only two options, and then you need to choose from the two answers, from the two options, and that would help you a lot. Then the third tip would be don't rush. You have enough time to solve the SPAs. So don't overlook the statement and assume your answers. So be careful, try to read the question carefully, try to read all the options carefully, and then solve the answer. Then another tip is clinical reasoning. Think about clinical implication of each option, and that would definitely help you. And the last is practice, which is the ultimate key to pass the exam. The more you would practice, the more you would retain the information. Okay, so for any technical support, you can contact these numbers, or you can email us on info@medinstitutors.com, or you can also reach us out on our Facebook page. Since we are going to start our new batch, so we Med Institutors, we have decided to offer our course at just $150. So grab this opportunity and try to start your exam preparation as soon as possible. Yes, sure. I'm coming back to your questions. Let me answer one by one. Okay, Neha, your query was regarding 4 years of Zenkani clinical practice. You need to book for the exam. Okay, so basically what happened, I was going through from the previous question. Someone was confused regarding at what time we need that clinical experience. So let me give you a brief. In order to book MRCG 1 and 2 exam, there is no need to show any clinical experience. In order to book part 1, you just need to prove your eligibility. You need to get your eligibility done by the RCOG. Once you have your eligibility done, go and straightly book your exam. For MRCG part 2 exam booking, that's a very easy, straightforward. Even it is more easier than booking MRCG part 1 exam. All you need to do, your previous exam result is already updated in your portal. So there's no need to show evidence for your MRCG part 1 exam. But yes, that is important. If you clear your part 1 exam, then you are eligible to book MRCG 2 exam. That's the only requirement. Then your MRCG 3 exam. In order to book your MRCG 3 exam, you need another form, which you need to fill that form. similar to your eligibility form, in which they particularly ask you about your clinical experience. That form has different criteria that choose two route. Either you're applying through route A or either you're applying through route B. Route A is for those trainees or the doctors who are working in first world country like US, Canada, Australia, or I think Sri Lanka. Some of the countries have they have that list, which are listed in Route A. So if you have that, if you're working on those in those countries, then you need only 2-year clinical experience. But yes, if you are working outside those countries which are listed in first world countries, then you need 4 years clinical experience, and they have that column in which you need to write your hospital name, number of clinical years, then the signature of your supervisor. Am I clear so far?
Ma'am, I have one question. Like,
Yes.
I have passed my PG in 2011, and now I am working as assistant professor. Now I'm AP in Medical College, Bombay, India, since
Yeah.
last almost 11 years. So, which is late? We have to do the latest 4 years experience or my PG experience followed by 1 year experience as assistant professor. Like,
Okay. Could you please tell me your name? I can't see on my screen.
Dr. Munira.
Okay, Dr. Manira, wonderful. You are doing great in your life. I'm honestly very glad to hear that you are doing so many things and you are such at high level. So coming back to your question, if you show your PG experience, that's enough. So you're good to go and write the exam in one go. And what would I suggest you? If you have such a good clinical experience and you are at a senior post, write your exam in one go. For example, if you are sitting in January MRCG 1 exam, once you're done with that exam, go with MRCG 2 exam in July. And then, or if you want to take some time, you can go and write the very next attempt of MRCG 2 exam. And after 3 to 4 months, go with the MRCG 3 exam. Because I have seen many doctors who have such a great clinical experience. They complete their membership within a period of 2 years. Am I clear?
Thank you. Yeah,
Okay.
thank you.
No problem. Because I usually advise if you passed your MRCG 2 exam, go with the MRCG 3 exam within 3 to 4 months period, because maximum information or maximum knowledge or the guidelines you need to pass the MRCG 3 exam, you have already covered them in MRCG 2 exam. So during that time, your knowledge would be fresh. So it is very easier for you to pass the MRCG 3 exam. Okay,
Thank you, Doctor.
no problem. Okay, Sadia, your question is, can we get training in Pakistan or anywhere after passing part 1? Okay, Sadia, there are some institute in Pakistan who offer training on the basis of MRCG part 1 exam, like Aga Khan University in Karachi or Shifa Hospital. However, all of the hospitals do not offer training on the basis of MRCG part 1. Okay, Ranim's question is, can I travel and work in UK with only first part, or I have to complete all parts? So basically, Ranim, in order to work in UK or to apply for a job in UK, you need to have GMC first. So you cannot go and or apply for the job just passing part 1 exam. You need to cover all the parts and then apply for the GMC. And once you have your GMC, then you can apply for the job and work in the UK. Okay, Muna's question is, I read it, you need 2 years experience for part 2 as well. Muna, that was a thing like 2 to 3 years ago. Now they have changed the guidelines. Now there's no need to have 2 years clinical experience for part 2. Yes, Neha, that would be counted. Sadia, a 2-year MO-ship is not enough, and it depends what type of MO-ship you were doing. If that doesn't include the clinical procedures like surgeries, that maybe make a problem. Okay, Neha, yes, ask away. No, Neha, there is no such rule. That was a rule. I don't remember exactly, but I haven't seen this rule from the last 3 years. Now they have exempted that. Now you can directly book your MRCG 1 exam, and once you pass that exam, you can straight away book your MRCG 2 exam. They don't ask you for a clinical experience, but yes, for MRCG 3, you need 4 years clinical experience. Do we have any other question, or should we close the meeting? I hope this session would be helpful and it would help you to trigger start your exam preparation. We on purpose added the femoral triangle topic so that you know that how you can study theory, how you can extract the high yield information, and how you can solve the SPAs. Okay, so best of luck. See you everyone in the next session. We have arranged another session on the basis of students' request. We are going to do another live session, which is mainly on the teaching of microbiology, in which we will explain you what are the high yield topics of microbiology and how you can study. It is similar as a femoral triangle, like we have theory in front of us, what type of information we need to extract and what type of questions we will get in the exam. And we would also practice some questions from the recalls as well. See you on Monday. Goodbye.
Bye. Goodbye.